Well, stick a syringe in it, but good luck killing it because this healthcare law is metastasizing and its high-cost tumors are, well, they're spreading. Washington State now the latest to look to put thousands of its workers into these new so-called healthcare exchanges. Why? Well, it will save them a lot of money, but it will cost all federal taxpayers more money. So says Ben Carson, the good doctor who became famous for warning the president to his face this financial whammy was going to cost us through the you-know-what. Now, of course, the doctor didn't say that. I did. But the good doctor's here to make sense of this because I sure can. All I do know, Dr. Carson, very good having you, is this thing is getting pricier by the day. What do you make of these developments now where states are saying, we'll take them on, but you feds pay the bill?
Well, you know, this is not unexpected. This is only the tip of the iceberg. There's so many things in there that are going to continue to be revealed. And, you know, the big problem here is that the Obamacare requires employers to cover anybody who works more than 29 hours a week. So naturally, people are going to try to manipulate the situation and create more workers that work 29 hours or less, which is problematic. Now, it's said that people of a certain income can be put into these exchanges and will be recipients of federal funds to help pay for them. Well, you know, that wasn't in the budget either. And a lot of people will be pushed in it, particularly lower wage workers. And then they're going to be dependent upon the federal government, which is already financially strapped, to now support them. And there's no guarantee that that's going to happen either.
You know what I wonder, you're the expert here, doctor, but that this was part of a master plan toward a single-payer system anyway. And this is leading us to that a lot of companies abandon their policies, beginning with initial coverage for part-time workers or those working, in, as you say, under 29 and a half hours, and extending it pretty much to all workers, and then states drop whatever plans they have in favor of the federal plan and get all state workers on that plan. In other words, this is where this is headed, toward a single-payer system, and that's the bottom line.
Yeah, whether that was the master plan or not, it certainly is going to be the final effect. And, you know, I wish people would start talking about some of the other ways that we can fix this. You know, I've gotten so many proposals from people all over the country. Some of them are really good proposals. These are smart people. If we would take advantage of what we have out there rather than taking this attitude that it's my way and it's the only way, I think we could really make some progress. You know, it's not a Democrat or Republican thing, a liberal or conservative thing. We all need good health care.
All right, but it is a costly thing, especially when we want to take some of the more prohibitive costs out of folks' pockets who are worried about it. In other words, this medical device thing that has now prompted a number of Democrats and Republicans to say, well, let's remove that. Well, obviously, you're going to have to get the money from somewhere else to pay for all of this. Where do you think that's going to come from?
More taxes. There are so many hidden taxes in the Affordable Health Care Bill, which is a strange name, that, you know, we all are going to be paying. You know, initially, just the rich, and then the semi-rich, and then the non-rich. You know, the money has to come from some places, and it's what happens when the government grows to this size. This is exactly what the Founding Fathers warned us against.
In other words, that the more you want, the more you're going to have to pay, and they've tapped a lot of rich people, and it's not enough to pay the bills. So how far down the so-called food chain do you see this going?
Well, obviously, it's going to affect everyone eventually. And you also have to remember that when you affect one segment of the population, we don't live in isolation. Every segment is going to be affected. So the people who create jobs, you know, if you're hurting them, they're not going to create as many jobs. On and on it goes. It's all a continuum. We're all in the same boat. We need to be talking about things that work for everybody in an efficient way.
A lot of folks want you to run for president. I'm sure you've heard that once or twice. Do you want to run for president?
I have no desire to get into that quagmire, quite frankly, but I must say I am besieged by people everywhere I go about this.
When you are besieged, do you ever entertain it?
Well, I always say it's in the hands of God. He will. I don't believe he's going to reject our nation just because many want to reject him.
So that sounds like you would be open to it.
always open to anything that God wants done.
Doctor, thank you very much.
Thank you.
Dr. Ben Carson.